First of all, welcome to the great city of Breaux, the crawfish capital of the world. Being here, hope you come back for the festival, first full weekend in May. Before we go any further, I will call Captain Waverson Guidry up to lay down some ground rules. This is a very small venue with a lot of people in a small space. We need to make sure that we do this the right way. So, Captain Guidry.
Good morning. Good morning, Rich. I would also like to welcome you to the great city of Breaux. We appreciate you all coming out.
Yes, sir.
I know that you all have questions, but we need to understand that in this format, we're looking to have civil conversation with the senator. We're asking that there be no loud outbursts, excuse me, no profanity, no yelling, no screaming, no standing up, no blocking, no coming up to the podium or anything like that.
Where's our rights?
Oh, Lord. We want you to know that we will respect your rights, but we also want you to respect everyone else's rights in the room.
That's right.
So having said that, I'm going to turn it back over to the mayor. We appreciate you coming. Have a good time.
Thank you. Thank you again. Welcome to the city of Breaux. We appreciate you coming. We look forward to the opportunity to share in a civil dialogue with the senator. We'll get to that in a moment. First, we call up Frank Cassidy, who will lead us in a prayer. Thank you. Good morning.
Good morning, Frank.
In the name of the Father, Son, and Holy Spirit.
Amen.
Heavenly Father, we thank you for allowing us to gather here. We ask you to bless them all here present, especially all the political leaders, that you give them guidance, understanding, and wisdom to carry out their duties. All of the people. In Jesus' name we pray. Amen.
Thank you. God knows I need that. So, next, we call up Repealing, who will lead us in the pledge.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Let me take a moment to recognize some of the elected officials, hopefully all of the elected officials that are here. First off, our Sheriff, Lonnie Terrio, who is. Secondly, we have the Ward 4 Judge, around here known as the City Judge, Randy Angel. We have Mayor of Parks, Kevin Catley. We have council members Daniel Richard, Chris Sullivan, and Dean LeBlanc. We have from the St. Martin Parish Republican Executive Committee, Michael Lunsford, Alan Gregg, and Rick Pearson. Lastly, the city prosecutor, Randy Rockout. Did I miss anyone? Oh, sorry. The Chief of Police. Coach Pat Arsenault, who else? Thank you. Thank you for coming. Senator Cassidy served 3 decades in the public health system, served the public. He was elected to the state senate in 2007, He was elected to Congress from the 6th Congressional District in 2008. He was elected to the U.S. Senate in 2014. He is currently our senior senator from the state of Louisiana. We're proud to have him. Senator Cassidy, welcome.
Thank you, Mayor. You know, it comes off too easily, senior citizen as opposed to senior senator. And so thanks for kind of almost getting that right, Mayor. Thank y'all all for being here.
You're welcome.
You know, first, let's thank law enforcement. We all join me in a round of applause for I will point out that in Metairie, although law enforcement was there, nonetheless there's some that got up and left because they actually feared they would be harmed. Now, that's not the problem of the folks there. They wouldn't have been. But nonetheless, we are secure. And we can thank our law enforcement for that. Secondly, let me thank you all. There are some of you who hate Donald Trump and might not like me either. And
Just the way you vote.
there's others of you who think, my gosh, we've got to get our country moving again. I am glad you're both here. Because let me now thank our veterans because they are the ones who fought to protect our rights. If we disagree with each other, we can actually say it and not be arrested. But I'll also echo what the mayor and the captain said. We have to respect each other's ability to speak. And if some folks want to yell and drown out others just to make a statement, that is not fair to those who are drowned out. So I thank you all in advance, even if you agree or disagree with me, that we will listen to each other and we will hear each other. And that is important. Let me give a Washington update. How do you start it without starting with Donald Trump? He has got everybody in a tizzy. Again, think about what happened over in Metairie. Folks are just beside themselves because of Donald Trump. Everybody's waking up at 3 in the morning to see what the latest tweet is. And I think it's important to look at what the president wants to do because you get distracted by those tweets. The president says he wants to make jobs a priority for the working Americans who've not done well over the last 8 or 9 years. Now that's a good thing. And when he speaks about infrastructure, $1 trillion, I'm not sure if he means one with a bunch of zeros behind it. What he means is enough that creates jobs for construction workers and then has that sort of long-term capital investment that just continues to ripple out through the economy. We know you got a better highway system, you're more likely to have a company locate in your parish that can then send goods east and west on the I-10. And I suspect St. Martin would be nicely positioned for such a business. When he speaks about increasing energy jobs have great wages and great benefits for working families. And that's a good thing. That's a good thing. And if we can create those jobs, by the way, I'll have a telephone town hall, we'll have 10,000 people on the line. There'll be somebody from Bogalusa, not in kind of a Acadiana parish, Bogalusa who was working on a rig, but because of regulations, that rig is decreased activity, and he's lost his job. Now we know what that means. He loses his job, the family's stressed. First they sell the bass boat, then the kids come out of private school perhaps, or parochial, and
Public.
or public. In some places the parents choose to have their kids in a parochial school. And that's good if the parents choose it. And then perhaps they lose their car and their house. It is something that you can write. On the other hand,
What about their health care?
if he or she has that better job, then the future for their family and the future for their children is that much brighter.
What about the environment and the water they drink?
And I tell you what, we'll get to that, but we respect each other's ability to speak. And so that said, when President Trump is favoring those jobs, he is favoring that working family whose future is brighter as we take care of it. Now, he's also interested in manufacturing. He wants to bring manufacturing jobs back to the United States. I think that's a good thing. We've lost some manufacturing jobs because of automation. We get that. Those jobs are going to be difficult to come back. But I remember when then Senator Vitter and I was then a congressman had a field here, went down to Lake Charles, had somebody come and speak. And they said because of the regulations that had rolled down, they had folded their tent and they had moved their company to China. Now, I will tell you that when a company moves to China, one, they no longer employ Americans, they're employing Chinese. They're not paying American taxes, they are paying Chinese taxes, but also it is worse for the environment. China takes 63% of its energy from coal. That's their feedstock. And you can look at graphs where on the east coast of China they are spewing SOx and NOx and greenhouse gas emissions, and it floats over the Pacific and it lands in the western United States.
They need some environmental regulations in China.
They absolutely have no environmental regulations in China.
We talk about China, we're talking about let's talk about the United States, not China.
Yeah, talk about here. Have a chance to speak, but please don't interrupt. So in the United States, if that job is created here, we're going to burn natural gas, nuclear, renewables. The extent to which we use coal, we're taking those greenhouse, the SOx and NOx out, and the mercury out, and we actually have less global greenhouse gas emissions.
Solar on the EPA. What is your position on the EPA?
Would you wait for your turn to speak?
Yeah.
Hey, he's got a legitimate question. Let him ask it.
I'm sorry, if I take a breath, please, that doesn't mean I'm not going to continue my sentence.
So we need to.
And again, I tell you, we have a First Amendment right to speak, but that is not necessarily a right to interrupt and keep others from hearing. And this is and this, although I'm having, I think I've had almost a town hall in every parish, although, and folks are welcome to come from elsewhere. This is my chance to speak to the people of St. Martin Parish and the people of Breaux. And so we're glad to have you. Please allow me to have a conversation. So that said, if Trump is successful in bringing, by the way, did I point out Trump upsets people? If Trump is successful in bringing manufacturing back to the United States, global greenhouse gas emissions will dramatically fall. I have
It's a pretty big deal.
I have a editorial I'm trying to get published. The point of it is that if Donald Trump succeeds, he will have a better environmental record than will Barack Obama. The other big thing on the table is the repeal and the replacement of Obamacare.
Yes, we have questions.
And so, for 8 years, the American people have been voting for candidates who say they want to repeal and replace Obama. And this culminated in the election of Barack Obama. And I'll call you. And this culminated in the election of Barack Obama. I've worked in the charity hospital system for 25 years. Caring for those without insurance has been something I have dedicated my professional life to. But I will say the American people do not want the federal government telling them how to live their lives. They don't want the federal government saying you've got to buy this, and you got to therefore pay that much, and if you don't, we're going to penalize you. I can just tell you, folks don't want that.
That's not true. That's not true.
The example I use is the woman who I met in Jefferson Parish. And she walks up to me and she goes, "My name is Tina and I am pissed off. I'm 56 years old, I've had a hysterectomy, I have no children. I'm paying $500 more a month, and I'm paying for pediatric dentistry, and I'm paying for obstetrical services. I cannot afford that extra money I'm required to pay." Now, that is a voter, and she was angry. The American people don't want that. Now, President Trump has said that he wants everyone to have insurance, caring for those with pre-existing conditions, without mandates at lower cost. Now, theoretically, that's something we could all be behind. And as a physician who's caring for the uninsured, I'm all about that.
We already
put up
have
our own
it.
plan that attempts, in fact, I think, is the way to achieve President Trump's goals. And under our plan, we would take the money that a state would receive, where those eligible signed up for the expansion and for the exchanges, and we take that money, and we don't give it to the state, except as a pass-through. Ultimately, it goes straight to the patient. And it goes straight into an account which she has the control over. Now, some folks don't like the idea that an individual would have control over their own account. I think it's great.
How much are they
Because
gonna get?
having worked for a public hospital, I have found that when politicians control your health care dollar, you don't do well. When you control your health care dollar, then the system lines up to serve you.
Let's hear some numbers.
What we are trying to do is make a system in which the patient has the power. We would give her that credit. It would be advanceable, meaning that if she's lower income, then she would have a pre-funded health savings account. Now, under Obamacare, if she has a bronze level plan, and she takes her daughter to the urgent care center, she has a $6,000 deductible. $6,000. Not true. If you said to one of my patients who earns $25,000 a year, "I'm going to give you a policy, but you got to come up with $6,000 before it benefits you taking your daughter to the urgent care center," they would say, "Well, why don't you charge me $6 million? Because they're just as likely to have $6 million as $6,000. Now, as it turns out, the Obamacare bronze level plan is basically a catastrophic coverage without the pre-funded health savings account. Under our plan, she would have that first dollar coverage.
Which is the same plan that you have.
Yes.
One of y'all please leave and yell outside, but this is actually a conversation.
We want to speak to you.
You will have a chance, but let me first speak to the folks of St. Martin Parish and Breaux. Again, y'all can make this like memory where all you do is shout and nothing is accomplished, but that's not a good thing. Now, that's it. By the way, who would like me to finish what I'm saying?
Hurry up, if you hurry.
So under our plan, you would have a pre-funded health savings account. By the way, if she wished, if the mother, and usually it's the women who make health care decisions in a family, if she wished, she could pool the family's credits and they could buy a richer family policy. Or she could assign it to her employer as the employee's contribution for an employer-sponsored plan. I see Karen Weibel over here nodding her head. She would like that. Turns out, CEO of your local hospital, turns out 74% of the uninsured are employed. If you give them can't afford what the employee has to put up as the employee match, under our plan, you would get that money and she or he would be able to use it as the employee match and get onto the employer's. Now that's a good thing. Now, we also put in something else, price transparency, meaning that if the doctor orders a CT scan, if the doctor orders a CT scan, the mama can scan a barcode. She can say, I can get my daughter's CT scan right now for $2,500 right down the street. or I can go at midnight on Thursday and get it for $250. She is going to look at her daughter and she's going to say, baby, we're staying up. Because she'll then be able to go and get that lower price. By the way, I mentioned those two numbers. There was an article in the Los Angeles Times a few years ago that says the cash price for a CT scan in the Los Angeles basin varied from $250 to $2,500. The patient would never know unless he or she was an investigative reporter for the newspaper. We want the patient to know. We want he or she to be able to make a decision about how much to pay for health care, just as they would how much to pay for health.
Yes.
That's a good thing.
Yes. You all the applause this.
What?
Let's talk a little bit about mental health. I got a question back there from somebody who asked, what about the Mental Health Reform Bill of 2016? And I make sure I get the question exactly. And I told her I'd take this first.
And now, do you have other questions?
Dr. Cassidy, regarding the Mental Health Reform Act, what is the progress? And she also told me of a relative of hers who committed suicide. Now, address both. Everyone in this room is affected by somebody who has serious mental illness or addiction. Everyone in this room. True of my family. It may be a family member, a friend, someone you went to high school with who seemed to have a promising life and ended up with a tragic end. The federal government spends money on mental health as you might expect. Billions. Some of it good, some of it totally wasted. In our mental health bill of 2016, which then became 2017, passed on a bipartisan basis, signed into law by President Obama, we take the billions, we attempt to take the billions spent by the federal government and focus it down on the serious mentally ill and those who are addicted. Getting resources to local and parish and state governments to provide the services that are needed. You will speak to your sheriff, and he will tell you that he is the largest mental health provider in this parish. That is not a good thing. That is a terrible thing. We want that person who's mentally ill to be in an outpatient treatment where he or she is actually functioning in society, not incarcerated for breaking a window.
No guns.
Give them the right to buy a gun.
What we're trying to bring up to
That's what y'all do.
among the things we have in this bill is funding for jail diversion. If somebody is mentally ill, not lock them up, but rather put them someplace where they can actually get the services that they need.
I'll let them buy a gun so he can take himself out.
Suicide. Let me mention suicide. There's been a lack of research on suicide. As one example, the NIH spends, I think, maybe a little bit rusty on this, on the first number, not on the second. On the first number, the NIH spends 144,000 research dollars per person who dies of HIV death, which is a very important disease, but only 987 research dollars per person who dies of suicide. Now, far more die of suicide than of other conditions for which we spend far more. So what we are asking NIH to do is to redirect dollars to where there is a greater need. If you look at just the number of people dying, suicide prevention is one of those greater needs.
How about research into gun violence?
Related to that is that there is a suicide rate among veterans that is continuing to come. Now, when I first heard that, I thought these would be the young men and women returning from Iraq and Afghanistan. It is. It is also our Vietnam vets, our Korean War vets.
What about Agent Orange Bill?
And some World War II vets. Now, the Veterans Administration, I am on that committee. The Veterans Administration is a huge system. we've made progress. Obviously, they are building new clinic buildings both in Lafayette and in Lake Charles. Desperately needed, long overdue. We worked hard to get those done. I'm pleased to say they are now happening. But let me also say, in many cases, the Veterans Administration does not fulfill its promise to our veterans.
You got that right.
And you can look where in one facility they're doing it right. And across the country there's another facility where it's being done very poorly. The woman that helped me on my staff work on the mental health bill of 2017, who really negotiated it, worked with hospitals and others to come up with something that worked. I'm going to ask her to begin working with the Veterans Administration. How can we make sure that no matter where that veteran lives across the country, that if he or she has a mental health need, it is met quickly and effectively, with good follow-up, and hopefully begin to do something about the suicide rate, which is tragic among any, but for those who serve, we don't want a end result of their service to be a higher suicide rate. And so it's one of the things that we are committed to. Let me see if there's anything else I wanted to mention.
Can we start asking questions?
Just a second, sir.
I'm a veteran. I'd like to talk about your veteran program, sir.
Please let us ask
I
questions.
think that's it. So,
Oh my God.
who has a question?
I have one.
I have one too.
I have a personal care service with the elderly and disabled.
Will you stand up, sir, so they can hear?
Yeah, speak up,
Clear
please.
on, Joe.
I have a personal care service for the elderly and disabled. The state, due to cutbacks, we all know what kind of shape the state's in, but we've been cut back 26% on our reimbursement rate. President Obama had the Fair Standards Labor Act rewritten, and we never had to pay minimum wage for overtime. I don't have a problem with the minimum wage, but the overtime, with the rates being cut, I'm paying out of pocket for the group that I have to supply care to in overtime. That's one of those presidential fiats. Do you think you can get Donald Trump to look into that?
Yeah. One thing that
didn't go through.
One thing that Joe was saying, he reminded me that he was at Mardi Gras a few years ago, and I got him a seat, so it was nice to kind of,
Buddy Brand. Another paid vote.
Oh, I'm sorry, the question, I apologize. He mentioned that he runs a home health service, and what he didn't say, but what I know, is that he is capped in the amount of revenue that he can receive. The president signed a couple of laws, one requiring him to increase the wage base which he pays, which he said he's okay with, but then he has to increase the amount of overtime that he spends. Now, he's capped in the amount of money that he can bring in as revenue under contracts and Medicaid
he's not. It's paid through
reimbursement,
Medicaid.
but his costs have just increased dramatically because in a business like his cost is principally people. And he can't get more efficient because he is so people-oriented. Fair statement, Joe? Yeah. And I hear that over and over. Nonprofits, similarly, who live upon donations, suddenly found they were having to lay people off because of the overtime rule.
But it didn't
And
go
they cannot
through.
provide
The
the service
overtime rule didn't
that
go
they
through.
thought they could previously provide. The President Obama, obviously with his executive orders, is the one that created that.
Jindal
created
Medicaid is not capped.
So Medicaid reimbursement per recipient is down. What we are doing in Congress right now is looking at the regulations that President Obama was shoving out the door in the last 6 months of his administration. And the administration.
Blame President Obama for everything.
I'm not everything. It was always Obama. Again, let's listen. I'm trying to answer a question. And I will call on you, ma'am, but please let me answer this question.
You know, answer the question.
I'm answering it now.
No, you didn't.
So what we're trying to do is look at those regulations that were over the last 6 months, and those that affect someone like that nonprofit who's laying people off, who cannot do the service, as an example, can we roll back that regulation so that they can continue to do their service? One of the problems of Obamacare on a related issue was the employer mandate, which said to a small business owner, if you grow over 50 employees, you have to start paying a penalty, number one. And number two, that you have to provide insurance to all full-time employees. So what folks did, they made a decision. I'm not going to grow over 50 employees, number one. And if I am over 50, I'm going to reduce people's hours from full-time to three-quarters time.
The patriotic thing to do. Yeah, let's cut all everybody's insurance
in
out.
an effort to lower that cost. For example, the Lincoln Parish School Board, just put it out there. They were taking their lower paid workers, custodial and food service, and reduced their hours from full-time to part-time, and they just said explicitly, we cannot afford these benefits, and we don't have a tax base which will pay for it. So we have to recognize that, although I suspect that some folks won't like me to say this, is that in the last administration there were regulations which ended up hurting lower wage workers.
So does your plan fix that or not? How does your plan fix that?
By increasing the cost of employment.
How will your new plan fix that?
How much? By increasing the cost of employment, people had their hours reduced or were laid off. Now there was a question back there, how does my plan fix that? I'm glad they asked that question. One thing we do is we repeal the employer mandate so that no longer if somebody grows over 50 employees, will she or he now get a penalty wall. Secondly, by repealing that mandate, there's no reason for the Lincoln Parish School Board or anyone else to reduce hours from full to part-time because they will still be able to afford to pay them.
And no insurance.
We also do recall, by giving someone that tax credit, which they can then give to their employer as the employee's contribution for employer-sponsored insurance, we make that person receiving that credit able to buy into the school board plan.
Really?
So, now, next question. Ma'am, what would you like to say?
So we still screw the lower income people.
Yes, ma'am.
I was born in Youngville, Louisiana. No different than all of you. I was raised speaking cotton. So I never asked the government like y'all like to think for nothing in my life. Not a thing. No food stamp. No welfare check. I'm here to set the record straight. I have never asked the government for nothing. I paid insurance. Y'all like to say about the deductible. I worked at Martin Mill. All of y'all had people in Martin Mill when it closed. Okay? That's the only way a lot of us could afford insurance. And let me tell you about myself and my story. Okay? Never asked anybody for nothing. Work hard all my life. Paid insurance. What y'all paying now is a drop in the bucket for insurance. 20 years ago, my insurance, just my husband and myself, was $400 a month. Because we owned our own business. Okay? Like y'all like to say. Now it was either save my house or pay insurance. A place to stay. So you know what? We made the decision. We're gonna take care of ourselves. We're gonna go to the doctor 3 times a year. Keep a family doctor. Went to a paid hospital. Paid my bill when it came in. We had to drop the insurance. Let me tell you what happened to Evelyn 7 years ago. I caught a stroke. Don't smoke, don't drink, did everything right. What y'all have to think about is, that's good to say we don't want in Obamacare, we don't want this, we don't want that. Let me tell you about myself. The ambulance picked me up, and I went to Lafayette General for a stroke patient. And you can roll your eyes if you want, but I'm talking about myself. For a stroke person, I never had to ask anybody for anything. Whether it's Trump, Obama, I really don't care who's president. I worry about my neighbors. I worry about myself. And when I went to the hospital for a stroke patient, Mr. Cassidy, let me tell you what they did. I was home in 5 days. So don't tell me Obamacare doesn't work. Because you want me to tell you about my deductible? Because the state of Louisiana, my deductible was a hospital bill that was $35,000 that I have to pay, okay? A doctor bill that I have to pay. So my question is, think about when y'all say y'all don't need Obamacare, because you know what? It might be yours, or yours, or yours,
Your name
or
is
yours. Because myself, I have a so if I would have got sick and you would have okay Obamacare, and that's not talking about Medicaid.
Can I respond to that? Everything she just said, I effectively agree. For 25 years, I've worked in the public hospital system trying to care for those who are uninsured. For 25 years, if the resident called me at 3 in the morning, I would get up and go to the ICU and do an endoscopy trying to save someone's life. And I understand what she just said. There are working families out there who cannot afford insurance. She mentioned the medical bill she has, $35,000. And now she and her husband have worked so hard. Ma'am, I admire you for your ethic and for, now,
A health savings account's not
under
gonna
our
fix that.
plan, under the plan that I'm attempting to put forward and have folks in the Senate who are supporting me, we will address that. For example, a huge issue is pre-existing conditions. She mentioned that. Under our plan, the state would have the option so that all those who are eligible would be enrolled. And you start bringing back in those young males who are very healthy. I'm sorry, I'm getting feedback. Is there a way I can make this feedback better?
The mic right there.
That's from that microphone. I may just have to turn this off. So, if we, so pre-existing conditions, if you can get those young men in who are healthy, under the President's, under the Affordable Care Act, they're paying 3 to 5 times more than they ordinarily would for insurance. And so they're not signing up for insurance. They're paying their car note, they're paying their rent, they're paying their student loans back, they're trying to start a business, or maybe they're going out to a sports bar to have a beer. But the point being is that they're not signing up for the insurance. And the only folks that are signing up for the exchanges are folks who are older and are sicker. And you end up with premiums out the roof. As an example, a friend of mine who's 60, his wife's 61, something like that, they got their quote from Blue Cross. I put this on my Facebook page because people don't want to believe it. Their premium costs $39,000 a year. $39,000 a year, which is more than the median family income in Louisiana. That is a system not working. Under our plan, in which everybody who is eligible would be enrolled, capturing, if you will, those young, not a mandate. They don't have to be in, they just call up and say, I don't want to. But the credit they receive is adequate to pay their premium for the year.
Regulate the insurance company.
If you do that, I'm going to turn this off.